making sure that he or she does not bite down on the thermometer. Remove the thermometer to check the digital reading. Finally, write down the time that the temperature was taken, the temperature reading, and where you took the temperature from. There are several important things to remember, no matter what type of thermometer you use. Mercury thermometers should not be used because mercury is toxic. If you have a mercury thermometer, contact your local health department to learn how to dispose of it. Do not leave someone alone when taking his or her temperature. Take the temperature reading before giving any medications for reducing fever, and at least 15 minutes after the person has had anything to drink, because fluids can affect the temperature reading. The length of time needed to measure a temperature varies by the type of thermometer you use. When you buy a new thermometer, read the instructions so that you use it properly, and ask your doctor if you have any questions. If the person with a fever is uncomfortable, there are medications he or she can take to reduce fever. Acetaminophen and ibuprofen are safe and effective if given correctly. Use medication that is right for the person's age and follow label directions carefully. Never give aspirin to anyone younger than 18 years old unless it has been recommended by his or her doctor. Never apply rubbing alcohol to someone's skin to try to bring down a temperature. Alcohol can be absorbed through the skin and cause health problems. There are times when a person with a fever needs medical help. The temperature that indicates that you should get medical advice varies depending on the age of the person who is sick. You can get more detailed information about when to call a doctor from the Massachusetts Department of Public Health website or from your doctor or nurse.
Another common symptom of the flu is a dry cough, meaning that it does not bring up mucus. Drinking lots of fluids can help a cough. Water, broth, juice, and non-caffeinated tea are all good choices. People who are sick should avoid alcohol, caffeine, and cigarette smoke, which can make symptoms worse. Over-the-counter cough medicines may relieve the cough, but they do not treat the illness that is causing the cough. Gargling with warm salt water several times a day or using throat lozenges may also help soothe a sore throat and relieve a cough. How can you keep people with the flu comfortable? Again, Dr. Stone.
It's normal for people with the flu to have body aches, headaches, or a sore throat, and to feel weak and tired. To help ease body aches, help the person who is sick to change positions in bed, and if possible, to get out of bed and move around 2 or 3 times a day. The same medications that are used to treat fever can relieve headaches or body aches. A stuffy nose may also be a symptom of the flu. To help a stuffy nose, drink plenty of water, juice, tea, or soup. Use a clean, cool mist humidifier or steam from a hot shower or bath to keep the nose and throat moist. Sit up or keep the head raised. Crib mattresses and children's beds can be slightly raised by placing books under the legs at the head of the bed. Decongestants like Sudafed or Contact and antihistamines such as Benadryl or Claritin may help relieve stuffiness for adults. Do not use these medications for children unless your doctor recommends them. When you lose more water than you take in, you become dehydrated. Dehydration can happen when people are sick with the flu. Both children and adults who have mild or moderate dehydration may feel more thirsty, be slightly dizzy, or have a headache. In children and babies, mild dehydration can lead to their being less active and can also cause a slightly sunken soft spot on top of a baby's head. To prevent and treat dehydration, the person who is sick should drink plenty of water, fruit and vegetable juices, or soups. Drinks like Gatorade for adults and Pedialyte for children can be useful. Encourage the person who is sick to drink small amounts frequently. Always avoid caffeine and alcohol. Keep an eye on a person who is sick since dehydration can occur very quickly, especially in young children.
Finally, you may have heard about antiviral medication for the flu. Antivirals can be prescribed by a doctor to help prevent and treat the flu. If you take these drugs within 2 days of getting sick, they can lessen your symptoms, shorten the time you are sick, and make it less likely that you will spread the flu to others. Most healthy people do not need antivirals for seasonal flu, but they may be recommended during a pandemic. We've been talking about how to take care of a family member with the flu at home. There are times when a person with the flu needs medical attention. Learn now about when to call a doctor so that you can be prepared if someone in your home becomes sick. For some symptoms, immediate action is needed. Get emergency medical help by calling 911 if a person has trouble breathing or chest pain. You should also get emergency help if he or she shows signs of severe dehydration. You should call your doctor if the sick person has any changes in mood or awareness, for example, becomes irritable or confused, a fever or cough that goes away for 24 hours and then returns, less than the usual amount of urine or urine that is dark, for infants, a decrease in the number of wet diapers, a stiff neck, a severe headache, severe sore throat or earache, an unexplained rash, mucus that becomes thick or changes color, difficulty drinking or taking a bottle, or severe or persistent vomiting. Also, call your doctor if the person who is ill feels sick for longer than 10 days. You should also call your doctor if you have any other concerns about how the person is acting. Prepare yourself before you contact your doctor. Before calling, have information ready about the person you are caring for and make a list of the questions you have. You can get a helpful form from the Massachusetts Department of Public Health website to use before calling your doctor. The form will make it easier for you to organize information about the person who is sick. Providing care for someone who is sick can be stressful. Let's hear from the Massachusetts Department of Public Health.
Hello, I'm Donna Lazorek, a public health nurse from the Massachusetts Department of Public Health. When you're caring for someone who is sick, you may feel worried or anxious. You may be more forgetful, have less interest in daily activities, or feel more irritable and impatient. There are several things that you can do to maintain your strength and ability to take care of others. Eat a well-balanced diet. Avoid drug and alcohol use because they can make you less alert. Do things that will help you relax. Breathe slowly and deeply. Try to make time for light exercise, such as taking a walk. Find time to get rest if possible. Planning for help can reduce your stress. Arrange for someone to care for family members in case you become too tired or if you get sick yourself. If anyone in your family has special health care needs, make sure that your backups know how to care for that person. Remember, you can ask for help when you need it.
There are things you can do now to prepare for seasonal and pandemic flu. During a pandemic, it may be more difficult to get to a store. For example, if several people in your family are sick, it may be hard to leave the house. Stores may run out of some supplies or may be closed if employees are out sick. Have items on hand that will help prevent the spread of germs in your home. Keep a supply of soap, alcohol-based hand sanitizer, and paper towels. Make sure you also have tissues, trash bags to line wastebaskets, and household cleaning supplies. Keep a supply of medications that you may need. These include medicines to treat fever, headaches, and body aches, and cough medicine. It is also good to have a measuring spoon or medicine dropper to make it easy to give the right dose of liquid medicine. Remember to keep all medicines out of the reach of children. Check the expiration dates on medications in your home regularly and throw away any that have expired. It is very important to have a thermometer for measuring body temperature. Have thermometers that are right for the age of the people in your home. Stock fluids that work well for people who are sick. Also have on hand foods that are easy to digest, like oatmeal, applesauce, and rice. Finally, keep a supply of medication, special foods, and any equipment needed by you or your family members that have any chronic illnesses or medical conditions. We've covered a lot of information about the flu, what it is, how it is spread, how you can avoid getting and spreading the flu, and how to take care of someone with the flu at home. It is important to remember that much of the care that you provide for family members who are sick with seasonal flu will be the same if they are sick with pandemic flu. We encourage you to take some important steps to prepare yourself and your family. Talk to your doctor about how you can be ready if someone in your home gets the flu. Prepare your home with the supplies suggested in this video. And check the Massachusetts Department of Public Health website for more information about the flu, preparing for family emergencies, and many other health topics. We thank you for taking the time to help prepare yourself and your family for the flu.
Hi everyone, we're back. We only have a few minutes and Mary Ann is going to tell us where you can still get the flu shot. Most important.
That's right, because that was a lot of information, but remember the best way to be prepared and the best way to avoid the flu is to get your flu shot. You can still contact Lynn City Hall. We're giving out flu shots to any Lynn resident age 18 and over. If you're not in Lynn, contact your local Board of Health. I'm sure they'll be happy to give you your flu shot this year.
Couldn't be any easier than that, right?
Yeah. Well, it is a lot of information. I mean, once you do
It
have the
is.
flu, I thought the hand washing piece was very interesting, and they always tell us to tell kids to wash your hands, wash your hands, wash your hands, and the best way to make sure a child's washing his hands long enough is to have them sing Happy Birthday twice.
Oh,
While
perfect.
they're singing
Here it is.
Happy Birthday twice, have them wash their hands. That's 15 seconds. That should
Wow.
be enough time to. So there's
Twice.
a little
Okay.
tip
I
for you.
like
Happy
that.
Birthday twice.
That's
while
great.
you wash your hands.
I have to remember that myself.
And that would do
Oh,
it.
that's great. Wonderful. So I think we get a lot of information today. And the more information people get, the better it is. That's absolutely true. And that was a good film. So thank you. Thanks for coming. Thank you,
you.
Mary Ann. It
Thanks.
was nice to see you
It's
in
a pleasure.
person.
Thanks.
We've
It's
spoken
great.
on the phone a couple of times.
Bye.
Happy Thanksgiving, everybody. So that was great. That went very well.